Hey guys, Dr. Rodman here. Today we're going to talk about one of the major hidden reasons for lower back pain, the hip flexors. Some people know about these muscles, the iliopsoas, the rectus femoris. One of their main actions is to flex the hip, to bring the knee to the chest. Basically, the reason why they're such a big problem is that they start at the lower lumbar spine, the low back, and they insert really on the ilium here and then the femur, bringing the knee to the chest. So when these muscles get shortened and tight, it really can pull the spine forward and compress the joints in the low back, lead to a lot of lower back pain that just won't resolve unless that area is treated and stretched. So today I'm going to show you why it happens, how to diagnose it, and how to fix it yourself. One of the major reasons why it's a problem is because when we're sitting a lot during the day, our hip flexors are contracted. So they stay short all day. So people that sit a lot get a lot of chronic hip flexor tightness or lower back pain, and a lot of cyclists too. I worked the Ironman competition, and almost all the cyclists after had really severe hip flexor problems where they would come in like this and couldn't straighten up. So we'd have to do some work on their psoas or hip flexors, try to help them get some low back extension. So a great way to diagnose this yourself, to see if this is a problem, is to sit on the edge of a bed, something like this, and just go ahead and fall back and bring a knee to your chest. The leg that's falling down here should stay flat. If it raises up at all, then that's a possible sign of psoas contracture or even rectus femoris, one of the quadricep muscles, over tightness. So if that's the case, if you fail that test and you see your knee or leg popping up higher than it should, that's probably an area, and you have low back pain, that's probably something that you want to stretch. Basically, you're going to get your thigh flat on the table. You're going to push up with your hands and really extend that lower back. Job of this muscle is to bring the knee to the chest. Stretching it is going to be bringing the knee away from the chest or extending it. So I kind of like to hold that for 10 seconds and then bring the rectus femoris or the quadricep muscle into it and bring my heel towards my buttock like that. And that's a real good stretch. That's the easiest way to do it. For someone that has knee pain, this is a safe way to do it. Both sides. Usually 10 repetitions for 10 seconds. Get in a lunging position. And if you have knee pain, this probably isn't a good idea, but just leaning forward and just helping bring that knee away from the chest or extending that hip. You can lean forward, feel that pull in the front of the thigh, and then also lean away from the side you're stretching and really open up that hip flexor, that psoas, rectus femoris muscle. And my favorite way to do it is kind of an advanced way. It's a dynamic stretch, meaning you're stretching with movement, and that is called the scorpion stretch, and you need a little bit of space to do it. And I'll show you here. Basically, you're going to lay flat on the ground with your arms out in the T, like this here, and you're trying to touch your foot to your opposite side on the floor, and just basically swing. Just like that. And as you can see, you need a good amount of space for that one, but that's my favorite one right there. Usually just doing that for about a minute or two after you've already loosened them up by stretching them the first two ways will really help. So if you go ahead and try that test, see if you have hip flexor tightness. If you do, now you know 3 great ways to stretch them out.